We go. Welcome everybody to Clear Vision Wednesday. I'm Claudia Mühlenweg. I am the creator of the Natural Clear Vision Method, and we go live here every single week to educate you on all things vision improvement. And today is a topic that I really had no clue about until I met him, or my expert guest today. I will bring him on stage in a moment. But this was something I was like very surprised because we talked. I'm like, is there any connection to this breast implant illness? So welcome, Dr. Rob. Welcome to the show.
Thank
You
you.
are you're the leading expert in breast implant illness, which is something I never even concerned myself about, and I didn't even know there's a connection to vision. So explain to us a little bit like what is breast implant illness?
Sure. Thank you for having me on my show. I really appreciate the opportunity to share this with your audience. And so the way we view breast implant illness is there are lots of reasons and disease states that give us chronic inflammation. Some of them are autoimmune. Um, but in this instance, I see patients with symptoms of chronic inflammation that have a breast implant in place. So they may come to us and they may have problems with their vision. They may have headache. They may even have complicated problems with migraines, neck and back pain, musculoskeletal pain, um, shortness of breath, chest pains, heart palpitations, even neurologic symptoms in their arms and legs like tremor or neuropathic pain like shocky pain or tingling pain or burning pain. They can have all sorts of GI problems, constipation, diarrhea, bloating, swelling, cramping, urinary tract symptoms, vaginosis, proctitis. If you can name of something, I have
Wow.
been told about it, including really difficult to care for skin rashes that are relapsing and recurrent and sometimes don't heal.
Wow, that is, I mean, again, I had no idea. This is super fascinating. So do your patients that come to see you, do they seen a bunch of other doctors and like because a lot of these symptoms, right? Like blurry vision, headaches, migraines, it's like gut issues, right? Like so many things. How long does it usually take? And how did you, also, I'm curious, how did you specialize in this? Because you're obviously one of the world's renowned plastic surgeons. So how have you come to specialize in this?
Yeah, it was in 2016. I had a breast cancer patient, and my career has really spanned mostly taking care of cancer patients. So I did microvascular surgery and performed reconstructions for head and neck cancer, sarcomas, and breast cancer, since that's the most prevalent cancer we would see. And I did that for a number of years. And in 2016, a patient was relocating to Austin, where I practice, and she did not want her implant-based reconstruction anymore. She wanted to go flat. And so we did her examination, reviewed all of her diagnostic studies and laboratory analysis, and discussed with her how to do this. And she really wanted to have what's called an en-bloc resection, which is a pathology term. It just means really to take everything out intact, kind of like a tumor resection, which was nothing, unfamiliar to me since my whole career had been about cancer reconstruction. So I did that for her. And first and foremost, she did not have any evidence of recurrent cancer, which is obviously paramount for someone's health. But she, on cultures, had a E. coli infection, and nobody knew about this. It was not something that we could ascertain from her blood work. She had no other symptoms outside of one. She had a problem with fatigue. And many patients who've had cancer therapies, chemotherapy, suffer from bone marrow suppression and have problems with fatigue. So that was not something that really peaked, in my mind as a problem for this. And I believe, Claudia, this is why there are so many problems with understanding this issue is if I, after 20 years of taking care of patients, missed implant infection, how hard is it for somebody who never sees those patients to understand that that's potentially a problem? And I just saw a patient today who had run through a litany of doctors, the GI doctor, the derm, the rheumatologist, the GPs, the OBGYNs, and none of them know what's going on or what to do, etc. So for all your listeners, I think if you just showed up with a red swollen breast and had a breast implant in there, everybody would be like, it's a breast implant infection. That's it. But because that's not the case, because they come with a laundry list of symptoms that don't fit into a specific silo, it's very complicated for everybody who's on the other side in the provider seat to try to figure out what's going on with the patient. And then they kind of pass the patient off to the next specialist or subspecialist to figure out, what is going on. And that's why we have the problem that we have. I published a paper at the end of last year showing that in 600 consecutive explant scar tissue specimens that we took out, 29% had bacterial contamination. So when we have bacterial contamination, there's lots of things that can happen. And science has shown that you can create oxylipins, which is just another fancy word for an oxidative reaction that creates a problem in your body. There's many of these. To date, there's not a blood test to look for it. We hope in the future to have that for patients to give them a better understanding of the problem. And so we look forward to, putting more, research out regarding this problem. But that's how I view the problem.
And so do you also see that's really fascinating? So you had that patient and you kind of got more curious, like what's going on, which is always a great doctor in my mind is always somebody who's kind of digging a little deeper. I've seen this thing happening. What is it about? But so have you seen, first of all, why do anybody get an explant if they don't have health issues? Is it just like, because I'm trying to understand this a little better, like, because there's also, I obviously teach vision and eyesight improvement, and a lot of it is how we see ourselves, right? There's a lot of this. How do we not like to see our body? I mean, there's this whole connection of our vision on a bigger scope. So do you usually see patients when they have these symptoms, or is sometimes just their life goals have changed or how they see themselves, or like or is it really just when they get really sick?
Yeah, I think what I've experienced through my patients, and they're the best resources for this. I've done several shows where I've invited patients on to discuss, their experiences, and they have let me know that their choices to get implants were multifactorial. They may have seen someone in the peer group, a mom, someone else's mom, and they had breast implants, and it was felt to be, you know, okay because the adults had them. I've had people tell me, people from Germany tell me that they were affected by Baywatch.
Oh my God, that was huge in Germany. You're right, but I was already here, so I never watched it.
Well, I mean, I was like, oh my gosh, I remember it was a big deal, and I never watched it. I was working, but I was like, okay. And then I had somebody say Barbie, the doll. I've had people tell me they were bullied growing up because they were, had smaller breasts. It's a really, you know, when you listen to them and, when you listen to patients long enough, they'll tell you what's wrong. So these are obviously image issues and how they see themselves. And what we try to do is help patients who either, now are from a symptom standpoint, kind of at their wits' end and they just need help. Or if this doesn't align with how they see themselves anymore, then I get that request. But for everybody listening, I don't tell anybody that they need an explant. I would never do that. That's a decision that everybody has to arrive at before they ever come to visit me. And I'm the last person anybody wants to see. This is a complicated enough procedure, not because of the technical aspects, but all the things around it. I can take care of the patients and do it safely, which is obviously the concern of their loved ones. And if they have children and they're worried about, taking care of them. So that's not the problem. It's,
And I think Pam Anderson had her breast implants removed. Somebody told me recently, the one from Baywatch, right? Who's like the star. So you said, what was it, 27, 29% of those had bacterial infections that you removed, right? You do so the other ones basically didn't have infections. Am I correctly?
yeah. So what we think is happening in the other group that has symptoms is it's a function of their existing genetic capability to detoxify as they, deal with, like we all have to deal with, our environments. So the air we breathe, the fluids we take in and the foods we eat and the products we apply to our skin have a great deal to do with how we feel. And so understanding that and trying to be careful and cognizant about that and, get enough sleep, get up and get some sunlight and exercise. Kind of some basic things will do and go a long way for you. But those are, yeah, that's basically what I see now.
That makes sense. So in terms of vision, we talked a little bit before we went live because I obviously see a lot of clients with who already have eye diseases like cataracts, glaucoma, AMD. And you said because most of your patients that do the explants are like, 40s, 50s, something, but they're usually here, right? Depending on when they got them, what their life decision is. But what changes have you seen, or what changes have your patients told you about you? Because I'm not sure you keep seeing them after the procedure. You might not know, but what have you heard from your patients in terms of their vision, if they share that with you?
Yeah, so there's a difference, right? If you're having inflammation that affects your central nervous system, that can definitely affect your vision. So, from patient reports and their caregivers, the CNS symptoms do improve after explant. But one of the physical manifestations I was talking to you about is an improvement in the white part of the eye, the sclera. And this has been talked about, and many pictures have been shown across, many platforms before and after someone has an explant surgery to see the improvement in the sclera. And I'll give you my take on it is those folks that have that dramatic improvement are probably really lowering the amount of histamine being released. And that's part of, otherwise it doesn't make a lot of sense when you think about it. But if you can really reduce your body's um, response that way, that'll make a difference visually.
Okay, yeah, that makes sense. And you touched on migraines and headaches before, which is a very common thing that I also experience with my clients, right? There is always the strain, there's the, um, and it could be related to detoxification and diet and also screen use and all kinds of things. So, well, when somebody comes to you, right, they want to do this explant surgery, like, or what kind of testing? You talked a little bit about testing in the beginning. What kind of functional testing do you do when somebody comes to you?
Right. So the things that we want to do is, and I wrote the book above my shoulder, Sharp, about the methodology, is basically we want to meet people where they are, right? You can't pick your parents and you can't outrun a bad diet. So first and foremost, each of us has a set of genes and that allows us to detoxify. So we look at those genes and we know that with certain problems in detoxification, people will reach their limit and become more symptomatic. We then look at a combined toxin test that looks at environmental toxins like bisphenols, phthalates, glyphosates. We look for heavy metals. Many people have been exposed to heavy metals, tin, cadmium, platinum, all the things. And mycotoxins from fungus or mold is a fungus. There is an inordinate amount of that in the patients I take care of. So whether it's where they lived, where they work, someplace they encountered when they grew up or traveled, there seems to be an inordinately high amount of that, as well as what you would get from food sources like coffee that's made that's not mold free, or grains, or fruits, or vegetables that weren't taken care of properly. So there's a whole host of reasons, and I combine that with a basic gut test to look for balance in the microbiome. And as you would imagine, most of my people are out of balance. And then we look at metabolomics. We're trying to get as clear a picture about everybody's, baseline, including their hormones and other triggers in their diet, et cetera, to help build out a picture so that at the conclusion of what's a pretty involved process, both working with my detox team and having surgery and recovery, that they get better. We don't want anybody taking steps back without having a clear goal in mind. And we look at the ability to go back and examine their toxicity burden and make improvements in their home and their diet and overall environment as real habit changing goals that need to happen in their care plans.
So it sounds like there's a whole process. Like when somebody gets, connects with you. I know I posted the quiz on YouTube that you have to do an assessment, but you do all these, I'm assuming, since you're in Austin, in Texas, so you do this whole, describe to us a little bit the process. You do run all these labs, and then at some point when you decide to do the surgery or when they decide, then they're going to come to see you in Austin. But what's the pre-care, the pre-exams, and the post, because you talked about looking at like the home environment and the habits and all these things afterwards. Can you explain a little bit what that process is?
Yeah, for the first time, we're going to open it up to people not having surgery. So you can run our program in a group fashion with our detox practitioners. You can take advantage of our supplements, which are curated based on our patients' genetic profiles, and then do the testing. So that can happen now without me being your surgeon. And or you've had surgery already, or you're not going to have surgery. Now, if someone's coming to Austin to have surgery with me, we need to get these things started because many times, Claudia, people want me to do a simultaneous fat transfer. So we'll talk about that for a little bit.
Oh, yeah, sure.
Yeah, I can borrow fat from different areas of the body where we don't want it anymore and volumize the breast or buttock with it. So there's been this trend to be more, as we talked about, more natural, not have implants, and using your own fat as a way to do a natural or what's called an autologous augmentation because it's your own genetic material. It's coming from you. And so we try to get patients and meet them where they are in terms of their current toxicity, where their diet is, where their inflammation is, get that improved, optimized, so that if we're going to come have surgery, whether it's a month or 2 or 3 or 6 months out, doesn't really matter. They're in a better position once they arrive because we know that helps lower inflammation.
Okay, so yeah, tell me. So the fat, how does this work with see, I know nothing about plastic
Sure.
surgery. I didn't watch Baywatch or any of this stuff. So
Take
well, I
fat
had
out.
Barbie dolls, but it didn't convince me.
You take fat out with a small tube that you would otherwise discard it when you're doing liposuction. But we
Uh-huh.
maintain it in a closed system that's created just to take care of the fat. So we don't want to expose it to the outside environment. So it's all contained. I did this morning, in fact, for a patient. So where we usually borrow fat from is like the inner outer thigh area, abdomens, the love handle area. And then, today we put a couple hundred cc's of fat back per side, which is about a cup size change. And it just leverages your body's own ability to heal. It has your own adipose derived stem cells, pericytes, vascular cells, all the fancy soup that is needed for healing. And if you're closer to 20, it works better. If you're closer to 80, like most of us are now, it doesn't, you need to be optimized. We'll say that, Claudia.
Yeah, yeah, I've been doing my own journey, and I did a detox, a screen test, and definitely had mold exposure and heavy metals. It's like you said, I live super clean and healthy, but it's almost impossible to switch the coffee brand. I love coffee, so that's something, for instance, I wasn't aware of, right? That coffee, even if it's fair trade and organic and all this stuff, could have all these mold toxins. So I
Yeah.
only see a comment on YouTube that was like, see the toxic connection, have a friend who had her implants removed from severe infection. And so Nancy's wondering, what about the connection with how you see yourself in your body? I guess that's not really your expertise of like, how do you, like, what about the emotional component that people come to you at this point?
Oh,
I
yeah.
guess I can assume it's a big thing, right?
Yeah, absolutely. So I tried to actually get a psychologist on staff, and it hasn't worked out yet. So there's a book written by Amanda Savage Brown, and she talks about it's called Busting Free. Anyway, she talks about the body connection in a very specific way, and why many of the things that we see in the clinic um, have manifested. And so that's the short answer is I'm not a psychiatrist
Right.
just and I don't play one on TV. So basically, what I want to do is always provide their resources, and she's the best resource, as well as getting, therapy. We tell folks all the time that's important in terms of doing this. I just don't have the resource in my clinic right now.
Right. But you have this great book, which I also posted the link on YouTube. So your book is a great way to get started to learn more about this process, and then taking the assessment or anything else. Obviously, you have Instagram and YouTube and TikTok and all this stuff, which is all linked in the show notes. Anything else that you want anybody watching this to know that is either affected personally or maybe knows a friend or family member who has symptoms? Anything else you would want to
Yeah,
share?
something that we're going to start more and more and more is providing some free downloadable resources, and we'll get you links for them so that people who want to be introduced to this concept, don't know if it fits, exactly what's going on with them, can take advantage of that. We're going to have a newsletter that's going to be available that will update with different things about immunity and inflammation. And then we're going to create a membership type situation. So for patients, like I said, who can't come or are not sure, it would be an opportunity for them to learn more from an educational standpoint without all of the commitment of coming here.
Right, right. Well, this has been super interesting, Robert. Rob, thank you so much for coming on. I don't see any new questions on YouTube, but this is going to stay there. And as questions come in, we will make sure. And if I can't answer them, I will check with you, and we will make sure we get everybody's support. And again, get his book, go to his website. He has lots of different resources, and there's more coming. So thank you so much for